Hey guys, it's Dr. Douglas at Chiropractor in Jackson, Tennessee, and we have Mr. Gary here. And Mr. Gary, this is his second visit with us. He came earlier in the week with right-sided piriformis syndrome and some left-sided SI joint pain. And he's been dealing with that for quite a long time. And how did you feel, Mr. Gary, after the first visit compared to when you came in here? Good. And he did get a little sore, which that's totally expected, and but the soreness is not nearly as bad as the actual pain. Would you say so?
Right.
And he actually walked a lot better afterwards. So Mr. Gary was nice enough to let us film his second visit. So we're gonna do it. So you can go ahead and lay on your stomach. Feet are a lot more even. That right one's still a little short. And they get even when we bring them up there. So he's got a right-sided SI joint issue. All right, Mr. Gary, keep this leg straight. Raise it as high as you can for me. Drop it. Try this one. Drop it. Does either one feel more difficult to do?
Right side.
Right side. All right, we're gonna start here on the right. Little drop. He also has some T1 pain that he's been dealing with for quite a while. Okay, Mr. Gary, raise that right leg again for me. Drop it. Raise it again for me. Drop it. Feel a little bit looser that time?
Yeah.
Good. We did do the manual decompression on Mr. Gary on Tuesday. He said that helped him quite a bit. Raise that left leg for me, Mr. Gary. Drop it. Raise it up again. Drop it. One more time. Drop it. Okay. So now we're going to work on L5. It's going to be straight. P to A. Good. L4. L3. Good. Just keep breathing normal. Good deal. Moving good this morning, Mr. Gary. Definitely a lot looser. Now we're going to work up here on T1. Let that bend for me. Good. Good. All right. Lay on your back for me, Mr. Gary. this leg relax for me. You're going to feel this up in this hip joint and this knee joint. Good. Let this one relax. Ooh, good deal. All right, grab on to me. I'm gonna help you sit up here. There you go. Swing this way for me. Okay, look to your left, look to your right. Okay, look straight for me. Go left, go right, back left. Good, look straight. Bend backward. Look down. Look straight. Good. Alright. Look left. Look right. Good deal. Alright. Okay, bend that right there. Let that drop. Good. Mr. Gray was just telling me he was in a bad car wreck years ago. He was rear-ended. So, you know, and that's the truth with a lot of people. Relax here. We get years and years of trauma built up from falls, car wrecks, sports injuries, work-related activities, just living life, basically. And it may not amount to much at the time, but once those things pile up enough, you start to experience symptoms. There you go. All right, Mr. Gary, come on over here. So you're going to sit right here, swing your legs that way. Perfect. And scoot down this way a little bit, Mr. Gary. That's good, right there. That's good. Now, we did a very good exam on Mr. Gary on Tuesday to rule out any kind of contraindications to him getting this procedure. And we didn't find anything. Keep your teeth together, drop your head. Take a deep breath and blow out through your nose. Was that one as big as the first one? Yeah. You okay? Mm-hmm. Okay. I'll let you relax a little bit. That's a big adjustment.
It'll wake you up.
It will wake you up. Okay, put your hand right there for me. Bend right here. Good. Good deal. All right, I'm gonna help you sit up here. There you go. Awesome. So you just relax right here. Now, Mr. Gary, has some severe stenosis in his lower lumbar spine, the L3, L4, and L4, L5 levels, which is the most common place to have degenerative changes. And he was kind of in that limbo world where he wasn't a surgical candidate, but he also had received other pain management solutions, and that didn't really do much for him either. So thankfully though, this seems to be working for him, and this is his second visit, and you know, they build on top of one another. So the first one you do kind of experience a bigger type relief, I guess. And the more that you get it done within a short period of time, it'll last longer. So how would you experience, kind of say that this experience is to other chiropractic things you've had?
Much better.
Yeah.
Great improvement.
Good. Very good.
Technique is different.
Yeah. And we're decompressing the spine on the y-axis. So, we have the x-axis, the y-axis, and the z-axis. So, and we adjust the joints on all three axes. So, because they live in three-dimensional space, right? So, well, thanks, Mr. Gary, for letting us film you. And if you need to reach out to us, you can call the office at 731-736-4200, or you can go online at chiroplusjackson.com. Thank you.